This video is a training on how to use the OUD Prevention Specialist Dashboard for the Louisiana State Opioid Response Grant. I'm Sam Robinson. I work at the Social Research and Evaluation Center at Louisiana State University, and our unit has developed this system in conjunction with several of the staff people at the Office of Behavioral Health in the State Department of Health, and this is meant to supplement the written manual that all the users of this dashboard should also be receiving. The written manual will actually go into more detail than I will go into here, but we're also including this recorded video as a means of walking you through the process to give you kind of a good impression for what's required to use this system, how to navigate through it, etc. So as step one, you will be receiving an email address and password for access to this system. Once you receive this, use those credentials that you're emailed through the web link that you'll be given to log into the system in the way that I'll show you here. Just click sign in. Okay, so I've already got my email address, my username, and password here. Click the sign in button and you sign in. Now, if you're ever in a situation where you forget your password, or if you want to change your password, right on the sign in screen here, you have this forget button that you can click. And by doing this, you can follow the instructions and it'll send you an email to modify your password. For security purposes, you may want to change your password right away once you receive it. But keep in mind, if you do lose your password or change your password, then we won't be able to find your old password for you. On the back end, on the side that we see of the data, we don't actually see users' passwords. We can give you your initial password, but later on, if you want to change it, you should go through and change it yourself. So you need to have access to that email address that's going to be also your sign-in to get your new password. Okay, so sign in here, and this is the screen that you see. This is the dashboard itself, and there are several buttons here on the screen. These are the forms that you will use to go in and either enter new data or to view or edit data. Okay, but let me walk you around here for a second and show you some other things. You'll see first at the top of the screen this button that has our logo here. If you ever click this button, what it'll do is it'll bring you back to the main dashboard homepage. So at any point, if you want to go back to this page, you can just click this button to go there. Okay, you have a log out button over here, some account settings here, but you don't need to be too concerned with that, except to say once you're finished, if you're using a community type computer or a computer that you think someone might have access to who shouldn't, we do encourage you to log out so that you don't lose data or have someone accidentally mess around with your data once it's been entered. Because once you log in, anyone who has access to information for a given site, LGE in this case, can view and edit the information for other cases entered through that same LGE down here. And we'll talk about that in a minute. But for the first thing I'm going to do is I'm going to walk through some of these data entry buttons, or what I'll refer to from here on out, and what I also refer to in the manual, the written manual, as forms. Okay, these are forms, all these buttons. Okay, and you see there's two sections here on the dashboard. The first is data entry. The other is view/edit history. And there's, for each data entry form, there is a corresponding view or edit history form. For example, you can add a new Dropbox location here. You can view or edit a Dropbox location here. Safe storage and disposal can be added here, can be viewed or edited here. Okay? And that should be clear why that's the case here in a minute. But let's go through the add Dropbox location to give you an example of how to use and enter data into the system. So we click that button for this form, and here you see a place where you can enter in a new Dropbox location. Let me say ahead of time that this system is fairly intuitive, and a lot of this you should probably be able to understand and fill out if you're somewhat familiar or comfortable with using the internet and navigating through websites. I mean, it's pretty straightforward. but we do provide additional guidance here and through the manual to make sure you understand in sort of some level of detail how to use and navigate the system. And in particular, and in the manual in particular, I would look for this. In some instances, there are ways that terms are defined, or the way that the State Office of Behavioral Health would like information to be recorded. And in those situations, pay attention to that because there are some situations where otherwise, if you just go through the system without reading the instructions first, there could be some ambiguity about what's supposed to be entered or what's required, and that can lead to inaccurate data being recorded, or at least inaccurate in the sense of what the Office of Behavioral Health is looking for. And essentially, this system is being set up for reporting to them. Okay. So we've clicked here, we've got add Dropbox location, and here are a number of indicators that I refer to as fields. Fields or indicators are the same thing. So you've got LGE type, installation date, location name, it's got a description of what the location name should include, and additional notes, and then a submit button at the bottom. So for the first field, you'll see there's a little red star next to this one. When you see that red star, what that indicates is that a field is a required field. This system, which we're calling the SREC Data Hub, by the way, will not allow you to submit a form if you do not select an entry in a required field. So as an illustration here, if I just try to click select without entering anything there, submit, I'm sorry, I get an error code. Location name is required, LGE type is required. Both of these have the little red asterisk, meaning they're required fields. So what you need to do here, each user, when they click this button, will see their LGE listed. This is Metropolitan. It's just kind of a random name that we use for testing purposes, but that's the one that the test case here is associated with. So I click that one, and you need to do that on every form. You need to select your own LGE type. And there's kind of a technical reason why we have to do this, but it is required for all the OUD prevention specialists that they select this. Then there's the installation date field here, and when you click here, you'll see a calendar pops up, and it's really easy to select whatever the date was. So in this form, we're looking for Dropbox locations. Every time you have a new Dropbox location that you need to add that's been set up as a part of this grant, you'll go through and select the date that the Dropbox was installed. Then here it asks for location name. It says physical location or building name, city, and parish. So that's the information that the Office of Behavioral Health would like you to record. The physical location, the city, and the parish. So you may say, for example, here this might be a Walgreens in Baton Rouge, and the parish would be East Baton Rouge. Okay? And more specifically, it may say the Walgreens on Segan and Perkins. And that will be pretty clear what that location was based on the requirements here, okay? And if you have additional notes, you can do that in this field at the bottom for any of the forms that you need to enter. So if you need to say, enter information about an issue trying to set it up, or why it was set up there versus a more obvious place, or anything else that you think is important to provide context. Maybe some of the partners who are there, if it's worth recording, you can include that. The additional notes field is never required. It's always something that's just a little bit extra if it's something that you want to submit. That could be helpful in either for your own record keeping purposes or for the purpose of reporting. And then you'll click the submit button. On that note about the purposes of this system, there really are a couple of different purposes that it can serve. And the most obvious and necessary requirement of this system is for reporting to the State Office of Behavioral Health. However, It can also be used as a system for managing your information. The information is there and accessible to you. So really it's like a record-keeping system as well that you can use and access and use to communicate with your fellow staff or with your supervisors. And as I walk through the rest of the system, that should become a little clearer. So now that's been submitted, you see this, instead of seeing the error message, I see the form successfully submitted, and there's a reload form button here. If I reload the form, another form will appear like this. Okay, so if you have multiple Dropbox locations you need to add in one point in time, you would do that here and click submit. If not, you can go back to the home page by either clicking this button here or going up to the top button that we showed before to bring you back to the home page. So now that I've entered in a Dropbox location, I'm going to skip down to the View Edit History section, and here's a button for View/Edit Dropbox Location. I click it, and I'll see there's a couple of entries here. One I'd entered before, or someone else had entered before testing it out. You see it doesn't have the full location name there, so this one would not be giving us all the information that we want. But this is the one that I just entered that does have the location in the proper format. And you'll see there's some options here. There's a View, Edit, and Delete function. If you click the View button here, what you'll see is it brings up a screen where you can simply view what was entered in a slightly different format than what you saw on the ad screen, but looks quite similar. I can go back by clicking that button on the bottom of the screen, and if I need to make an edit, so if I made a mistake or found out new information, I can click Edit, and it will bring up a form that's essentially what we saw before, and you can go through and make all the edits here that you need to. So I could change the name to the Rite Aid's not around anymore, but Rite Aid, that used to be there, a similar location, submit it, and then go back to View Edit, and what we see is it's changed it from the Walgreens to the Rite Aid. And then finally, you can delete entries here. If you entered something accidentally or need to make so many changes, it would be easier just to add a new one as opposed to editing it. If you click a delete button, then you're going to see a message that pops up that says, do you want to delete this? If you click OK, it will delete it and it's gone. So take care there. If you enter information and delete it accidentally, you'll need to re-enter it for it to be stored. So use that with some caution. So going back to the main screen here, I'll just walk through these other sections as well. Here's Narcan distribution or education activity. So this form asks you for a few different kinds of information to be recorded here. So first I'm going to select my LGE. And that's what you'll fill out for this field that says what kind of activity took place. If I click this drop down, I see there are three options here. As it says in the form title, distribution or education activity can be reported. So if you're distributing Narcan, you would click this. If you're educating someone or some group on Narcan, you would click this. If you're doing both as part of a singular activity, you would click this third option. So for example, if you've gone to a local police department and you first give them a presentation on Narcan, and then you distribute Narcan for them to use, you would select this third option. But let's say for the case of illustration, we're just distributing Narcan somewhere. So I'll click that button here. Every time you distribute Narcan as a separate activity, you should enter in a new form here. The date, similar to what we saw before, it automatically will give you today's date anytime you click this form, but sometimes you'll be entering data from over the last week or something, and so you can just click whatever that date was. You'll see another required field here is type of audience targeted. And when you click here, you'll see a number of different audience types. Working with the Office of Behavioral Health, these were identified as the key audiences who are likely to receive Narcan or education on Narcan. And so you can go through and select them, and you can select multiple audiences. So I mentioned before if you're at a police department, but what if you're actually there and you're presenting it to social workers and nurse practitioners and we'll say police department too. We don't have a category for that. I just came up with that off the top of my head, but that would be other, okay? What you're gonna see is for each of these groups that you select, you're going to have new fields populate down here. Okay, so let me take these out and show you one at a time what's happening here, okay? So if I take them all out, there's nothing. The next field says which specific organization or population, which I'll get to. But let's say it's nurse practitioners. This new field is going to say how many nurse practitioners were present during the activity. This primarily refers to educational type information. But if you also are recording that information, have a means of recording that for those who are there just to receive Narcan, not necessarily how much you're distributing, but how many people were there for a given group, you can record that as well. But for the sake of making this pretty straightforward and easy to follow, this typically will mean how many were educated. So how many nurse practitioners were present? Typically that'll mean how many were educated during an education event. So we will actually probably use this in that instance. But if you say Narcan distribution, so we go back and say we're doing a Narcan distribution activity, nurse practitioners are the primary audience. You don't have to fill out this field because again, we're doing Narcan distribution. If, however, this instead is an education event, you enter nurse practitioners. You should enter information into this field every time. Ideally, for the education activity, so it's a presentation, a training, you will have an actual count based off of a sign-in sheet. If that's the case, you just sort of count up who's on the sign-in sheet. You ask for maybe the category, which would account for these kind of people, maybe social workers as well. And you'll enter in for each different group, you'll enter in the number who were educated. So for nurse practitioners, you could say there were 10. For social workers, you can say there were 5. And that's pretty straightforward. However, this other group is something that we need to talk about because if you click other, not only do you enter the number of others who were there, whatever that category was, so that could be the police, you have a place to enter who this other audience is. So you see these fields only appear when you select certain options here. So I'm selecting other because there were police department members. And we'll say the other audience was police. And then we say there were 25 police. So again, to come back to this, if you select Narcan distribution only, you do not need to enter in this information unless you have it. But if you are doing an education type activity, you should enter numbers. Ideally, it would be based on sign-in sheets or actual head counts. But in the absence of that, the best estimates you can provide, you should still provide estimates for how many were present. This is information that can be useful to both your LGE and to the Office of Behavioral Health to understand the scope of what you're doing and the impacts that you're having. So how many individuals are being impacted across groups is an important piece of information they can use for their decision making. Okay, so now we've got that piece figured out. There's another field here that says the specific organization or population targeted. So, in this case, this is sort of a hodgepodge of police, nurse practitioners, social workers. You could list all of them in a little more detail here. So you might say nurses at the Lady of the Lake Hospital. I wish I should say from. Because this is all in a similar activity, a similar location. Social workers from LSU and Baton Rouge Police. Okay, so maybe that's the population. Maybe you have another way of understanding or conceptualizing who the population is. But this field allows you to go into more depth than you see here, where it's just a general audience type. Here instead, you're getting into more detail about exactly who that audience is. So again, here's geographic location, and it's the same information that we saw before about physical location, building name, city, and parish. So here we may say instead of that that Walgreens example, maybe this is, we'll say the Baton Rouge Zoo, and then it's at Baton Rouge, East Baton Rouge. So Narcan kits, so this is, I said before, if you enter in education, you should enter counts. You don't need to enter counts. It's optional if it is a distribution activity. The opposite is also true down here, that if you are choosing a distribution of Narcan as the core activity, then you should enter the number of kits distributed here. In this case, since I'm saying it's an education only, there will be none, and I would just leave it blank. So you can leave it blank. You don't have to enter it. It's not a required field. You don't see the little asterisk there. And here's for additional notes, so I'll submit. Okay, I'll reload the form, and I'll just take another illustration. So let's say also we want to record a distribution of Narcan. And the audience is government agencies, leaders, and there were 3 of them, and it was local senators, and then the geographic location could be Capitol Building, Baton Rouge, East Baton Rouge. But this is a Narcan distribution event. So we're distributing Narcan to local government leaders for some reason, and we say we gave them 100 to go and to hand out to whoever needs to receive Narcan in the community. And then you submit it. Oh, I didn't select LGE. So this is something that as you use the system more and more, you'll see, right? You'll learn some of these fields have required fields. Some of these forms, I'm sorry, have required fields. You need to fill them out every time. Then you submit. So that's one thing kind of to keep in mind as well, since we had that happen right there. The form will not allow you to submit if you don't enter required fields. Oftentimes it'll navigate you back to the top of the screen there, but depending on the browser and depending on the form, that's not always the case. So if you're clicking submit and it's not letting you submit and you can't figure out why, you may want to scroll to the top of the screen and see if there's an error because you didn't enter a required field. Safe storage and disposal, so we'll go through that here. Well, actually, before we do that, let me go and look at the view edit screen for Narcan distribution or education. So you see I just entered in a couple here. Now, even though I just entered this first one and this last one, they're not together because they get ordered here based on the date of the activity. Okay, and so here you'll see all the information that I had before, as well as the view, edit, and delete screens. Since we're talking about this ordering, you can order and sort these fields in different ways by clicking the title header. So if you want to say, I want to sort all my cases here by date, you click this date. That's the default. And by default, it goes from, I believe, the earliest date to the latest date. But you can click this and go from the latest date as it is here to the earliest date. So you can sort it and reverse sort it. And you can do that by any field. That's any of these meaningful fields here. This view edit screen is a little bit different than the one we saw before because there was an interest from the Office of Behavioral Health in being able to use this form to view quickly the number of different individuals who had received trainings or educations. So you see this little bar here at the bottom. If I scroll over a little bit, I'm going to see also, so you scroll over and you see these counts here, and you can export these data into Excel format. To do that, you click this button. If that's information that you want to see and you want to be able to report on internally or to Office of Behavioral Health, beyond the reports that we'll be facilitating at LSU, you can click this button and it gives you these different options. Commas and tabs and JSON. If you want to put it into Excel, commas is a good option to choose because this will appear as a spreadsheet. And I've got my computer set by default to open it in Excel. Your computer may not have this, but we can certainly help you to figure out how to do this if you have questions. And so here it is. This information has been exported, and it's all in Excel, and all the information is there that was on the View Edit screen. So you can use this here, and you can rearrange it, export it, save it, share it, whatever you want to do. So that's something that the Office of Behavioral Health wanted to have. You can both see it in the actual form on the screen or export it to Excel. This is only the case in a couple of these View Edit forms. This one, and there's another one on presentations, general presentations made by the LGE, which I'll get to in a minute. So that's kind of the Narcan education, distribution and education piece. Safe storage and disposal is next. So in safe storage and disposal, you're going to select your LGE. This is any activity relating to the safe storage or disposal of drugs. And it's very similar to what we saw before. You enter a date, you enter an audience type, organization there, geographic location. The new field here is they have these methods you can choose from. And as with the last form we looked at, depending on your choice, you'll have some new fields potentially pop up. But before I get there, you also have pounds of materials disposed if it's available and appropriate, and additional notes. So let's say that our safe storage and disposal activity is a safe disposal bag. Well, now you see a new field, number of bags disseminated, because there are bags that are disseminated as part of this activity. If I choose Dropbox, it's not there because there are no bags, but there would be pounds of materials, and you'd enter that here. Lock your meds products, again, because bags are associated with it. Number of bags disseminated is here. And if you also are collecting materials, disposing of materials, you can enter that here as well. And then there's another option if there's something else. And here you see there's another new field that appears where you type in the other type of activity, as we saw previously when they didn't have a given audience type included on the form by default. Then there's additional notes and submit. So I'm not going to go through in as much detail as I did with the others because I think it's pretty clear how the View Edit forms work. You just enter in the appropriate information and submit. One thing I will mention is that thinking about what the data represents. A lot of the information you're entering into this system is activity data, process data. And that's important and something that is really an essential requirement of most grants. However, some of this information, and in particular, some of this information associated with disposing of materials, is more than just an activity. If you think about it, you're out there in the community, you're encouraging people to get rid of dangerous drugs in an appropriate way. And if they do that and you're facilitating this, this is actually an outcome, the material that's being disposed. And so one thing we would encourage you to think about, we are, many of us here in our unit at LSU we are evaluators, and we understand the importance of outcome data and trying to demonstrate the importance of the work that you're doing and being able to communicate the impacts that you might be having. Is the importance of understanding where there are outcomes and prioritizing, the importance of this really in your own mind anyway, is something that you're not just out there doing something, you're actually achieving something positive. And that's the case with disposing drugs, because you're getting other people to improve their way of thinking about things and their behaviors to promote the well-being of the public through this activity. So I just wanted to kind of mention that as a way of thinking about this piece of information here in particular can be really important. If you think about at the end of the day, when this grant is over, by collecting this information, you will be able to discuss this with other stakeholders in your community and say, because of this grant, we were responsible or contributed to, however many pounds of materials of drugs being disposed of. And that can be kind of a compelling argument for sustainability, for trying to maybe expand the activities that you're doing, things like that. Not that the other information is not important. This is all important information, but the outcomes in particular are something that you may want to pay some attention to. Okay, so going back to the dashboard now. Again, I'm not going to go into the view edit forms in great detail because it's more of what we've already seen, but here's something that was entered before, and you can just see it's a similar kind of screen. There's also this add filters button that you'll see, and this is just if you need to filter your information somehow, you can do that. But for most, this probably won't be necessary, but there may be situations where you want to filter out your information, and if that's the case, you can certainly use that option to restrict the information that you see on the screen. Okay. The last two forms are associated with trainings, and we already talked about Narcan education. However, these two forms deal with every type of training, meeting, or event that is not covered in really these other forms, and in particular Narcan-related educations. This form in particular for the trainings, meetings, events presented is important to understand in relation to this form here, because this will include all trainings, meetings, events that you want to record that do not have to relate to Narcan education. If there's a Narcan education event that you are responsible for, you will enter it here. If it is any other kind of education, so if you're talking about, broadly speaking, the SAMHSA overdose prevention, opioid overdose prevention toolkit, Narcan may be a small piece of that, but you're talking generally about the toolkit, that would go here. If it's any other kind of education, you want to educate the public on signs of withdrawal or signs of overdose or something, that would go here. If it's Narcan related, it goes here. So for these two forms, again, presented trainings, meetings, events, and the Narcan distribution or education, that is one area where your education for Narcan goes here, all the other education goes here. But any other general kinds of events or anything else specific not related to Narcan would go here. Now, this form, which we'll go to next, is for adding those that you attend. So this form really doesn't have anything to do with this other one because these are activities that you are responsible for. All of these are things that you're presenting to the community or activities you're trying to engage in to improve the well-being of people. This is something that you're doing really for your professional development. Trainings, meetings, events you're attending, or you're trying to network, you're trying to improve your own knowledge or skills in some area. So here, Narcan information can be submitted, but on the presented form, it cannot. So I think as you use this a little bit, it'll become a little clearer, but it's important to make that point early on because the Office of Behavioral Health would like you to collect all of your Narcan-related education events here, and any other education you do will be here. But if it's something that you're attending and receiving and not something you're presenting, including Narcan or anything else, it goes here. So again, just want to make that point. So let's walk through this trainings, meetings, events attended form. As it says, this can be a number of different kinds of things. Really, I guess the events and kind of catch-all would cover a lot of this stuff. But if there's something that you're attending and participating in, not presenting, you're not responsible for presenting information, it would go here. And again, we enter the LGE type. Here's the name of the training, the meeting, event, and you would enter that here. Okay. And so by doing this, you'll enter in, for example, let's say you're participating in some kind of social worker CEU training. So social work CEU training. You've got a date. You've got a topic area here. For the topic area, you see a drop-down list, similar to what we saw with the different user types in the earlier form. And here again, you can select multiple topics. And these are the key topics that the Office of Behavioral Health thought it was useful to kind of keep as a default systematic kind of list. But you can also include other once again. And if you include other, you see this field appears. If I take it out, it goes away. If there's a trainer, particularly if it's a training, you would expect to see a trainer, you would enter it. If it's just an event, there is no trainer, you leave it blank. Type of audience, again, this is something we've seen before, so you can pick down as many as you need. And you notice you don't see fields asking how many participated. The reason for that is that by asking that question, essentially we're allowing you an opportunity to get credit for the number of individuals who may be impacted or touched by what you're doing. But here you're not responsible. Again, this is professional development. This is to see kind of what you're doing to improve yourselves. And so you're not getting credit for it because you're not the presenter, so you don't need to document how many were there. You're one of many, okay? This field's very similar to what we saw before. Geographic location, we saw this before as well. And then an additional notes field. And again, not all of these fields are required, but things like this field and this field, you should fill out every time. Even though it's not required, it's something that should be filled out in every case. So make sure you get those filled out because it will allow you to submit, I'll show you, even without selecting those, because it's not listed as a required field, but of course, enter that information if you have it. So now I can go and view the trainings, meetings, events attended. I've got the filters. I've got the view, edit, delete, and you can scroll through and see that this is similar to what we saw before. It's a way of being able to look at what you've documented or to make edits if there's a change needed. So if I find out, well, on the social work CEU training, I accidentally said that there was a management treatment topic, but it really wasn't there. Instead, it was really SBIRT. Then I'll submit here. And then I go back and I see that SBIRT's now listed. Okay. So final form, add trainings, meetings, events, presented. So if you are responsible for presenting some training, meeting, event, and it's worthy of being documented in the system, you would enter that here. And so you may say, okay, we're doing training on the SAMHSA opioid prevention toolkit overdose. Okay, as I mentioned before, so what's the topic there? Well, we might call it general opioid education. You notice the Narcan option's not here, again, because no Narcan activity should be included in this form. If it is, it goes in that Narcan distribution and education form. Anything else education related goes here. Trainer name, type of audience, we've seen this before. And here's one just like that first field we saw in the Narcan form. Every time I enter in this group, we're going to see options appear for counting the number of participated, so you can, again, get credit essentially for how many people get touched. A good measure of activity. And then we've got the specific organization, geographic location, additional notes. And once again, I didn't fill all those fields out, even though you will want to fill out some of those at the bottom, such as who is a specific audience and what was the geographic location. But the view screens, the edit screens, they work the similar way to the way they did for the other forms. So that covers really a lot of what this system can do. I will add that this, similar to the Narcan piece, there's an export function here where you can export these data into Excel. And you can, through doing this, see a count of the number who participated by each different group. Coming back to an earlier comment I made, one thing that's important to keep in mind looking at the View/Edit History section is that when you click any of these forms open, you will not just see your own cases, but you will also see the cases from other users at your LGE. So that's important to keep in mind. And there could be a good reason for this. You know, by looking here and making sure, like you could check here before entering a new form to make sure that someone hasn't entered something that maybe two people were engaged in, to make sure it's not duplicative. You can also use this as a means of trying to review some information to say, okay, well, I'm not sure what happened. This will help to tell me whether or not we've already done an activity in this area, for example, and you can review things from that perspective as well. But you will have other users' information available here to view and edit. So take some care when you're using this section of the dashboard to understand and respect the fact that other individuals' information will be there. And you don't want to accidentally make some changes to someone else's information that might not be correct. So just one thing to keep in mind. So if you have any issues or concerns, your manual has an email address that you can use to communicate with us at LSU, particularly to deal with technical types of issues with the system. You can contact us through the dedicated email we have that's listed in your manual, which will be the SREC Data Hub at lsu.edu. This system is called the SREC Data Hub. And hopefully we'll be able to get back to you fairly quickly and resolve any of your questions or concerns. So this system is meant to be fairly straightforward and intuitive. The one thing that may create a bit of confusion, at least initially, is this the Narcan piece versus the trainings events. But hopefully we made it fairly clear the distinction between those two here. Okay, so good luck using the system. Log out there.